So I think that Women's Health Days in what's being developed here in Hamilton is really effective because it meets people where they're at. It is very harm reduction focused, and it also recognizes how many competing priorities these women have in their lives. So, when you're living outside and you are struggling to figure out where your next meal is going to be, where you're going to put your head down at night, where, how you're going to get a hold of your housing worker when you have no phone that was stolen the day before, you have no ID to get your medication, going to all these different providers all around the city to get things done is very difficult. And certainly getting things like cervical screening for pap smears for cancer screening is just not top priority. So having this kind of one-stop shop where people can access all these things that they need under one roof is really important. The other thing that I think really is helpful with these days is that it's not just healthcare that draws people in, because sometimes people might say, no, I don't need to go see, doctors for addictions and pap smears and anything like that. But I really would like to get a warm meal, and I'd really like to get some clothes right now, and maybe meet a housing worker. So people might come for other reasons, and then realize once they're here that these are a bunch of people that are really open and warm and non-judgmental, and then they might kind of be more open to receiving medical care. These are folks that feel judged every time they walk into a healthcare facility, every time they come looking for help, every time they just walk through a mall. They're stigmatized and they're judged. So when they walk into a place where they know that they're accepted, they can be who they are, and no one is going to be looking at them and treating them poorly, all of a sudden they might be willing to do all sorts of other healthcare interventions or housing interventions or any number of things that they weren't willing to do before because they were afraid of judgment and stigma.
So this is my second time being part of this, and I think that as a provider, it's pretty wonderful seeing so many different people from the community come together, trying to service this population that normally I find in my experience wouldn't be served. So things like PAPS, it's routine screening, and it's so important. And a lot of people in the community tend to put it off, but at least this is something that's easily accessible. We can get it done really quickly. And then we're still getting that prevention piece done. So,
yeah, I mean, I think there's a lot of evidence that, particularly for a population that has difficulty accessing traditional medical services, that one-stop shopping is sort of, really the way to go. And so, as you point out, bringing in, public health and, folks who can help people with contraceptive, reproductive health care, substance use, cancer screening, mental health, STI screening.
Like you said, it's all there.
Yeah, I work at a managed alcohol program for people that are precariously housed and have an alcohol problem. And I mean, we're not set up at the clinic there to do PAPs, so there were a couple of women from there that came to one of these Women's Health Days, and they both had PAPs and STI screening, and it turned out they both have abnormal PAPs and STIs, so it was really, really helpful, and I never would have known that without having that.
Well, it's really interesting too, because from one station to the next, we kind of like work with each other. So speaking to an individual, and as we're talking about preventive screening with PAPS, all of a sudden something else got brought up, and we're like, well, why don't you go and try out this station, and connecting them to that resource that maybe wasn't part of their day. So.
Yeah, like the woman that we saw earlier, who we actually did a PAP on and talked to her about STIs and hepatitis. Yeah, and she says, oh, yes, well, I've been treated. However, I would like to be screened again. And we were able to say, so you just need to go around the corner and you can have point-of-care testing done. So, yeah. And the thing that was interesting is the second patient that we saw, who is a resident here, who has access to the health clinic 3 half days a week, who had never come down for a PAP.
Yeah.
And came down for a pap smear. Because, it's been talked up. It's, I think been promoted appropriately. So she came down for a PAP. I went, okay, great.
Yeah.
It's a really good experience to also be one of those people who can reach out. So we do a lot of naloxone training, and we get really good feedback from the people who come to our station. So yeah, it's just a great way to give back and to know and understand that there is a need for what we do.